Yoga for scoliosis. Can it make a difference? Yoga is an ancient practice combining deep breathing, physical poses and mental focus. It roots back as 5,000 years in India, and there's many benefits of yoga are now being backed by science, including stress relief, anxiety, increased strength, increased flexibility, and balance. So when we look at scoliosis, we know scoliosis is an unnatural sideways curvature of the spine. This scoliotic spines also rotate or twist from the front to back, and the rotation is typically into the concavity of the scoliosis. Scoliosis introduces a lot of uneven forces to the body, so when we look at scoliosis, can it be treated with yoga? Now, we know scoliosis is a complex structural spinal condition, and structural is the key component here. And it's also progressive, meaning it's going to worsen over time. We just don't know exactly to the extent or speed it's going to worsen, but we know curves do worsen. And scoliosis can affect all ages, and it has multiple different types of scoliosis in terms of severity and types of causation factors associated with it. And since it wides randomly in severity from mild to moderate to severe to very severe, the impact on scoliosis is very different from one person to the other. So no two cases of scoliosis are the same, and no one form of treatment is ever enough to address all the condition's complexities. And it's necessary for scoliosis patients to have a customized plan that's crafted for the individual needs to integrate very specific treatment plans to fulfill their goals. So yoga can be one facet of treatment, but it's not enough to induce a structural change in the majority of scoliosis cases. So what are some benefits of yoga for scoliosis? First of all, like I mentioned, it can increase spinal strength. It can definitely improve posture because yoga definitely has long sustained holds, and we know when you hold a position, you're recruiting more type 1 muscle fibers, and type 1 muscle fibers are typically associated with postural improvement. It also can improve or help increase spinal flexibility, and this is done because you're doing a lot of stretching or flexibility movements associated with yoga. So we know it can help improve spinal flexibility and mobility. There's also some types of yoga that yoga instructors have tried to design specifically for unnatural spinal curvatures. But very often these yoga instructors can't diagnose your exact curve type, so therefore they're more generalized movements based upon maybe a lumbar curve or a thoracic curve or an S curve. And if you don't know what type of curve you have and you're performing these types of yoga movements, there could be some limitations on what type of improvement they can develop. So yoga tends to be a very symmetrical practice. It assumes that one side of the body is a perfect mirror image of the other side of the body, and this is what I was alluding to. And when you look at patients with scoliosis, they don't have this symmetry. In fact, the very nature of scoliosis is asymmetry, and it's more than just the spine. It can be everywhere from the feet to the skull and everything in between. And therefore, since scoliosis itself can't deal with all these structural components, it can't actually reduce a scoliosis curvature. And by the time most patients can perform yoga well, this asymmetrical development has already occurred in the spine in juvenile and adolescent years. So once this asymmetrical motion and asymmetrical development has already occurred, the spine isn't moving symmetrically in both ways. And this lack of mobility prevents you performing symmetrical yoga. So this idea of having balanced muscles with this type of yoga approach is almost impossible for a patient to perform. And in addition, there is some yoga movements that can actually exacerbate the scoliosis and some of its known imbalances, especially with arching of the back and flattening of the thoracic spine, where the majority of patients who don't have scoliosis are normally trying to improve hyperkyphosis of the thoracic spine and improve lumbar lordosis. Most patients with scoliosis have hyperlordosis of the lumbar spine and a very flat mid-back, meaning hypothoracic kyphosis. And most yoga poses are encouraging this extension type of movement, which could have a negative impact on scoliosis. So therefore, there's a couple of things when we look at yoga. We know it can be a fantastic form of exercise, and I definitely recommend patients with scoliosis to consider yoga as a form of general fitness. But they have to be worried about some of the positions they get into and some of the things that they can't do, because scoliosis is an asymmetrical concern, and they're performing symmetrical yoga, and they have to make sure that they're not doing anything that can exacerbate their current scoliosis condition. So if you have scoliosis and you're being treated by a scoliosis professional, and you are considering yoga to be being used to help manage your scoliosis, understand there is some limitations because it's mostly used for general fitness, general flexibility, but it doesn't have the capability of actually correcting scoliosis and reducing your curves. Now, in some cases, it can help you with any kind of pain or discomfort that you may be having, but it's not going to reduce the curve. And then, unfortunately, in some other cases, it can actually exacerbate the condition because of the asymmetrical effect that scoliosis already has. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.